Hi, my name is Kelsey. I'm your nurse today. What has brought you to the ED?
Hi, I'm Sam. Every time I pee, it's cloudy and my stomach hurts, and I think I have a UTI, but I get them all the time. I just need the medication.
Okay, we're going to have to run some tests, but you said you have a lot of UTIs. How common are they?
I usually get them a few times a year. I just need the antibiotics.
Is there anything that you've noticed that causes them?
No, they've just been more common over the past few years.
Have you had any major life changes in the past few years?
I got the cutest French bulldog. His name's Spike. I moved to a new apartment, and a few years ago, on my 30th birthday, my fiance broke up with me. Yeah.
It sounds like you've had a lot of changes in the past few years. How have you been handling all those changes?
I've been fine. I love my dog in my apartment.
How about your separation from your fiance? How have you been dealing with that?
Oh, I've been living my best life. I don't even need him anymore. I've been with plenty of guys since then.
I'm really glad you brought that up. Do you mind if we talk about your sexual health?
Yeah, sure. I'm an open book.
Can you tell me how you practice safe sex?
Yeah, I'm on birth control. I'm fine. I have nothing to worry about.
That's great that you're on birth control, but there are also other things that are important when practicing safe sex.
What do you mean? I told you I'm on birth control. I'm fine.
Birth control definitely helps protect you from unwanted pregnancies. However, another way to help prevent against sexually transmitted infections is by using condoms. I understand you are aware of the importance of birth control to avoid unwanted pregnancies, but I believe you could use some pointers regarding the avoidance of your frequent UTIs as well as the avoidance of STIs.
I mean, I get UTIs all the time. I'm used to them at this point. I just take my medication as prescribed and they go away pretty quickly. I'm not so worried about STDs. Birth control is a lifesaver.
Do you see any connection between your sex life and your frequent UTIs?
Not really.
Well, in some cases, UTIs can be caused by poor sexual hygiene. Some ways to help prevent the UTIs are by peeing after sex and by wiping front to back.
Oh, well, I guess I didn't really know that. These UTIs are actually getting kind of annoying, so I'll definitely try that out.
You mentioned that you've been with plenty of other guys since your breakup. Was there ever conversation about possibly being tested for STIs at some point with these other men that you've been with?
No, I mean, that wasn't necessarily on my mind. At the moment, I don't want to, offend anyone. It kind of sounds like I'm calling them dirty.
Asking a partner you're not very familiar with if they've been tested is not offensive. It's a reasonable question considering it can negatively affect you in the long run.
I've never really thought about it like that. I guess that's true, though. I've just been trying to have a good time. My fiance leaving me this late in the game was definitely a tough pill to swallow.
It sounds like your breakup is something that is still affecting you today. I appreciate you opening up to me about it. You're very strong for what you're going through, and that this is something that no one should have to go through alone.
Yeah, I mean, at this point, I'm not really looking for love. I'm just fooling around, I guess.
What is likely to happen if you don't have this conversation with your partners about being tested?
Well, I guess I could end up with a sexually transmitted disease, and that'd be kind of gross.
It's clear that you're willing to learn this information. Could you tell me the main 3 things that we talked about today to prevent UTIs and to practice safe sex? I want to make sure that I explained everything clearly.
Yeah, so I'll be sure to use condoms, pee after sex, and wipe front to back.
Yes, perfect. Those should help lessen your UTIs. On a scale of 1 to 10, 1 being low and 10 being high, how confident are you that you'll be able to make these changes?
Well, I'm confident that I can pee after sex. However, the condom thing I'm less thrilled about, so probably a 7.
Okay. I appreciate your honesty. I'm going to run some more tests and someone will be in soon to discharge you, and you should follow up with your primary care doctor in about 3 weeks. The doctor will come in and give you your medication for your UTI.
Okay, thank you.
Bye.
Hi, I just wanted to update you on the patient that came into the ED earlier, Sam.
Okay.
So in this interview, the client comes into the ED with signs of a UTI and is just looking for medication. As the interview continues, it becomes clear that the client is partaking in sexually promiscuous behavior after her breakup. The nurse learns that the client has been sexually active with multiple different partners recently. However, she is very uneducated about safe sex. The client does not usually wear condoms and does not question her partners about being tested for sexually transmitted diseases or infections. And the client is in the pre-contemplation phase due to the fact that she is under the impression that birth control protects you from everything. The nurse continues to explain the correlation between her UTIs and her not peeing after sex, and the nurse proceeds to educate the client on the importance of protection other than birth control to protect you from sexually transmitted diseases and infections. The client gets tested for the UTI as well as the STIs and will be coming back for her follow-up in about 3 weeks with the results. And the client started off uninterested and change. However, by the end, she was willing to learn and willing to change, which has moved her into the contemplation phase.
Great, thanks for letting me know.
Hi, my name is Sarah. I'm going to be your nurse today. How are you feeling?
Hi, I'm Sam. I'm doing well, thanks.
I see you were in the emergency room about 3 weeks ago. How have you been feeling since your last visit?
Well, not really great. I just finished my antibiotics like a week and a half ago, and usually my UTIs are gone by now. But for some reason, it still burns when I pee, and my stomach hurts more than usual. They told me in the emergency department that they were going to run some tests, but I haven't heard anything.
I'm looking over your test results, and we tested you for some sexually transmitted infections at your last visit in the ED. It looks like you have a sexually transmitted disease called chlamydia, which is why you still feel like you have that UTI. Are you aware of what chlamydia is?
I've heard about it, but I didn't think people actually got it.
You can get it by having unprotected sex. Fortunately, this STI is treatable with some oral antibiotics, and it should be cleared up in about a week. The signs of chlamydia are similar to a UTI, along with abdomen pain, but this antibiotic should help.
Oh boy, this is exactly what the last nurse warned me about. I feel so stupid and disgusting. I wish I had gotten the whole safe sex talk earlier.
I see that you're feeling frustrated with yourself right now. However, there are many ways to avoid this in the future. Luckily, chlamydia will clear up with medications that we give you today. However, there are other STIs like HIV or herpes that are incurable, so it is important that you make these changes.
I know. I need to be more careful with this stuff.
In the past few weeks, what changes have you made?
So I actually took the nurse's advice. And the past few guys I've been with, I used a condom and I peed after sex.
It is clear that you're really trying to change your ways when it comes to safe sex.
Something I haven't done yet is ask my partners about their history of testing. I just think it would be really uncomfortable to ask them.
I'm really glad that you brought that up. I know it can be uncomfortable asking your partner about this, but the purpose is to protect yourself and any future partners that the two of you may have. Do you have any ideas on how you would bring this up to your partners?
I don't really know. It's kind of an awkward question to ask.
I understand. It is an awkward question to ask, but it is an important one. It may be helpful to practice what you will ask your partner in front of the mirror or if you are comfortable talking about it with your friends. Additionally, it may be easier to ask your partner if you become more comfortable with them before sleeping with them.
I guess. I really just don't want to get chlamydia again, and I really don't know how to ask.
Whether you know him well or not, it's probably best to be upfront and to not complicate the question. Just ask, have you ever been tested for a sexually transmitted infection before?
Yeah, I don't want it to be a long conversation about asking, so I guess that could work.
Do you have any other questions for me about all this information?
No, it's been a lot to take in, but I think I understand.
It seems that you have been making progress. On a scale of 1 to 10, 1 being low and 10 being high, how confident are you that you'd be able to continue to make these changes to practice safer sex?
Now that I know all this information about how to help and prevent UTIs and about how to prevent from getting those gross STIs, I think that I might try trying everything the nurses have said. I think probably about a 9 now. Once I work on asking my future partners about being tested, I think that could definitely help me make a change.
I'm really glad to hear that. You can pick your antibiotic up at the pharmacy later today. To be safe, do not have sex for 10 days in order to protect yourself and others. We will set up an appointment to meet in 10 days to run some more tests. After you leave today, please feel free to call us at any time if you have questions. We are here to support you.
Okay, perfect. Thanks. See you in 10 days.
Hi, I just wanted to update you on the patient, Sam, that came in a few weeks ago. In this interview, the nurse and the patient talked about the test results with the patient's past visit to the emergency room. The patient seems to be in the contemplation phase when she comes into the visit today because she is considering making changes. The client expressed that she was making changes and trying to have safer sex practices by wearing condoms and wiping from front to back. As the interview continues, the nurse and the patient continue to discuss how the client can ask her partners about whether or not they have been tested. The patient continues to learn about the STIs and how they can be prevented, as well as what to do when she has one. The client seems to express that she wants to ask her future partners about whether they have been tested, and she does not know where to begin. The nurse and the client discuss how to bring it up. The client also finds out that she has the STI chlamydia. She's disappointed that she ended up with this disease, but seems willing and confident that she will make changes to improve and to work on safer sex. The patient also seems that she will be compliant with antibiotics for chlamydia and will continue to practice safe sex In conclusion, the patient leaves the appointment in action phase.